Hello, my name is Aisha, and I am going to demonstrate VaxConnect, our digital innovation designed to enhance immunization service delivery and supply chain management in API clinics. So this is the landing page for VaxConnect, and here you can see a modern and intuitive interface designed to introduce you about our comprehensive vaccine management tool. So here you'll see our mission, which is comprehensive vaccine management platform for health facilities, setting the tone for what Vaccine Connect offers. As we scroll down, we have a snapshot of what the tool looks like once we log in. This is the admin view, but I can go into that in a bit. And then you can also see a section that talks about how VaxConnect works. It highlights key features such as supply chain tracking, individual immunization record, session management, facility dashboard, data analytics, and compliance ready platform for vaccine administration. And it also showcases how VaxConnect streamlines vaccine administration. Next is the National Health System Integration section, which lists the VaxConnect's integration with essential national health tools such as Master Facility Registry, DAGU, DHIS2 Health Information System, and the National Product Catalog. And finally, there's the job aid section, which can be used by data clerks and staff at EPI Clinic to aid them with vaccination schedules and guidelines, and it details the vaccines that need to be administered at different age from birth to 15 months, along with important notes on minimal intervals for catch-up vaccination, which is based off of the EPI guideline. All right, so now let's start to explore the platform. So before we start exploring the platform, we have to log in. And to log in, we have two options. We can either log in as an admin user or we can log in as an EPI data manager. So the admin user is basically, it has the ability to set up a new EPI clinic, a new facility, and it's a self-onboarding process, which we'll see in a bit. And a data manager is connected to an individual EPI clinic, and it performs the day-to-day activities performed at the EPI clinic, such as immunization, creating a session, receiving stock for the EPI clinic, and so on and so forth. So let's look at each of these in detail. So I'm signing in as an admin user, and once I sign in, there's the admin dashboard, and on the admin dashboard, I see that I can initialize a facility, which is the self-onboarding bit, or I can do user management. So let's start with facility setup. So when we start with the facility setup, what we're currently doing is we are onboarding a facility to start using VaxConnect. And how we do that is the first thing that we need to do is select a health facility. And these list of health facilities, we were able to retrieve them from MFR, Master Facility Registry. So these are verified list of facilities in Ethiopia. So we can select one of the facilities here just for demo purposes. And once we select a facility, we can either change the facility if this was selected by accident, or we can proceed to the next step, which is adding EPI clinics. So we can add multiple EPI clinics depending on how many EPI clinics this specific hospital has. So let me start by adding one EPI clinic, EPI1, supervisor's name, contact number, it's an optional field. I can put in a phone number, and then working days. So it allows us to flexibly define which days this EPI clinic works. So it might work Monday, Wednesday, and Friday. We can create a clinic. And since facilities might have more than one EPI clinic, it also allows us to create more than one, but I'm going to skip it just for demo purposes. So once I'm happy with the EPI clinics, I can proceed to user creation. So for the user creation, I can add users. These are users that will be able to access the system for this specific EPI clinic. So let's select which clinic, EPI1, full name, email address, and then role. So is this user a supervisor, a vaccinator, or data entry clerk? We can also enter a phone number. Now that I've entered the details, I can create the user. So let me review the information I've added. I've added a facility, I've added EPI clinics, I've added users. Now that I'm happy with my setup, I can complete the setup. So we see this message, the facility has been successfully initialized with EPI clinics and users. So once we're done with the setup, we can log out from the admin user and we can log back in as an EPI data clerk. So yeah, let's use this credential. So this is the account for a data manager, and we are now going to log in as a data manager for a specific EPI clinic. Earlier, we were logged in as an admin, so an admin has the ability to view data from multiple facilities and multiple EPI clinics, but now I'm logging in as a data manager for a specific EPI clinic, and I'll be able to perform day-to-day activities for that EPI clinic, such as starting a session and immunization processes. So let's start with sessions. So I can click on the Start a Session button, which begins vaccination activities, and it also helps me manage my inventory. So let's click on the Start Session button. And what I can do in this session is it could be like a routine session, it could be like a daily session, or it could be a monthly session. I have the ability to specify that. And let's give it a name, session 1. And I can select what kind of session it is. Is it a routine immunization, outbreak, catch-up, school-based vaccination, and so on and so forth. For demo purposes, I'm going to select routine immunization. I'm also able to select the number of days for this session. So it could be like a 2-day session, or it could be a 1-day session, or it could also be a 30-day session if we're talking about campaigns, or even more. So this allows us to be flexible with the number of days for the sessions. And then these are health workers that have already been configured for my EPI clinic. So I can select who's going to be administering vaccines in this session. I've selected these two. I can also add notes for this session. And then once I'm done with this, I proceed to stock receive. So what we're doing here is we've created a session and we are selecting the stock that we're going to be using for this specific session. So there are some stock that would expire, or once they're opened, they would only be working for a single day. So, or there are some stock that might last more than a day. So we can specify the quantity here. We can say I received 6 of these, BCG, polio, and so forth and so forth. I can select which ones I want and increase the quantity of the ones that I want. I can also add the batch number and expiry date, this is the manual entry, or I can scan a QR from the store that lists the stock for me. And okay, let me scan the QR. So once I scan the QR, then I'll be receiving the data from the store. So here we can see from the QR code, I was able to get this vaccine in this quantity, in this batch number and expiry date. So this is an easy way of receiving stock from the store as opposed to doing a manual entry. So this application supports both manual entry and QR scan. QR scan is faster and it's less prone to error. So yeah, these are the stock that I've received. Now I can confirm the receipt. And finally, this is my session overview, session information. This is what I selected earlier. And this is the stock that I received from the store. I can finally confirm receipt and start my session. Now my session has successfully started, and it says that I have received 178 items. I can also see an overview of my session here. So there are a number of actions that I can take now that I've started my session. I can record vaccination for an individual child, or if I am missing stock for a specific vaccine item, I can refill my stock. I can also adjust my stock for wastage or damage. And finally, when I'm done, I will finish the session. So we'll go through each individually. Now let's start with vaccination of a new record. So this is the page for recording a child vaccination, MRN number. So this is the child's registration number, full name, age in months. So this will help us relate the age of the child with the specific vaccination appropriate for that child. So let's say my child is 3 months old and is male, and I can select between normal schedule or late catch-up. Late catch-up is for when a child misses a vaccine in the previous, when they were supposed to take it, but they come after a while and they're catching up for that vaccine. And this also follows the job aid from that EPI guideline. So now we select the vaccination period. So my child is 3 months old, but for which vaccination period am I getting the vaccine for? That's what I'm selecting here. So let's select this. And here we see that available vaccines for 14 months are these, but I don't have any in my stock. I don't have any of these in my stock. So let's select something else. Okay, so for a 6-week child, I have received Penta and PCV. So let me select these two, and let's say that we are vaccinating the child with these two vaccinations. So we see this message to administered for a beva. So now we have recorded one vaccination for a child, and we can keep adding that vaccination record until they're done for the day. So the next feature that I want to show you is refilling of stock. So if the EPI data manager notices that they're missing a stock for a specific vaccine type, they can go to the store and ask for a refill. Let's say that I need the polio vaccine. I can ask for this. I will need to add a batch number and an expiry date. And now that I have selected this for items to be refilled, let's confirm refill. It shows me that it's near expiry, it expires soon. So let me confirm this refill. So stock refilled has been successful. So this is the refill feature, and there's also stock adjustment. So if some items have been damaged or broken, then I will be able to adjust my stock for that by accounting for the damaged ones. So adjustment quantity, let's say that 8 have been damaged, expired, lost, or missing, and a few from this has also been transferred out. Then some from this were lost. So I can adjust for this. First, I will review the stock. So it's saying we're doing 8 adjustment, 3 and 4 item quantity adjustment. And let's confirm this adjustment. Now we have successfully adjusted 3 vaccine stock levels, and we should not be able to see the adjusted columns filled out. So finally, once I record all the children that come for vaccination for the day, I can finish the session. And here it shows me, so we have 17 remaining from the hepatitis B birth dose. So was there any damaged? How many was returned? How many was discarded? This is the reconciliation part of it. And it also shows that 17 have been unaccounted for. So the data clerk would have to fill this form and finalize the session. So because I did not fill any of these, it's not letting me finish the session. So the data entry clerk would have to fill these. So maybe I'm gonna return these. So 34 have been damaged. And I need to fill all of these out before I can finish a session. All right, So we have just finished a session, and what we can see next is the dashboard. So if we go home, this is the home page, and in the vaccination analytics page, we can see, yeah, in the last 7 days, we vaccinated this number of children. The most popular vaccine has been this. The daily average is 44 children per day, and 8 different vaccines have been administered. We also have a breakdown of vaccination by gender, how many were late catch-up and how many were scheduled, and vaccination by session type. Was it a routine catch up or campaign? We're able to see all of that, and also a detailed report per facility level. We can also generate reports. Yeah, so we can also generate immunization tally reports on a daily basis or a monthly basis. So we can select the date or the month, and we would be able to see this monthly tally report. There's also catch-up vaccination report, monthly tally report, vaccine performance and session analysis reports. Yeah, and then additionally, there is inventory. So this is the stock report. So how much stock was received in the past 7 days, how much was total used, total wastage, and average wastage rate. All of this will be able to see per EPI clinic level and also on the national level for better decision making. So additional reports and charts such as vaccine stock breakdown, wastage contribution by vaccine, monthly trend report, and so on and so forth. Multiple reports have been included in this VaxConnect solution. We believe that VaxConnect can unlock the full potential of data to support every child's right for timely and effective immunization with these features that we just demonstrated. Thank you very much.